I did the first cesarean section in this district. Nothing was being done that time, and it was a bold decision, but we were both determined.
And I'll begin the story with the year 1986, when Rani, my wife, and I had just returned from the US. And where should we work?
Mr. Abhay was born in the Varda district. He lived and studied in the Mahatma Gandhi Sevagram Ashram. His father was a freedom fighter who diligently worked with Mahatma Gandhi. Further, he went to the USA and did masters from Johns Hopkins University, USA. Inspired by Mahatma Gandhi, he and his wife Dr. Rani Bang came to serve the tribal communities in 1986.
Our purpose was to serve the most underprivileged and disadvantaged people. I did the first cesarean section in this district. Nothing was being done that time, and it was a bold decision, but we were both determined.
In 1988, child mortality rate was measured for the first time in Gadchiroli of approximately 1 lakh population in 100 villages. The infant mortality rate was high at 121. The main cause of death or problem was pneumonia and newborn deaths. No global program or national program was there to address these issues. Dr. Abhay Bang and Dr. Rani Bang came up with a solution of Harogaduth messengers of health. The concept was that one literate man and woman in each village created a system for help. This system helped to reduce the count from 121 to 80. To further reduce from 80, they trained village women to become village-level neonatologists. 39 women were trained for home-based newborn care in 1990. The infant mortality rate after this moment decreased by 62% in 3 years. Asha model, a national policy, was built on the model of Harogaduth. 9 lakh Ashas were trained under this model.
In my experience as a gynecologist, I found that from menarche to menopause and even thereafter, women have so many gynecological problems, like menstrual problems, sexual problems. They have got reproductive tract infections, what we call white discharge. They have pain in abdomen, pain in back, and they have breast problems. I did the first community-based study of gynecological problems in rural area in Gadchiroli. That study was published in Lancet. It's supposed to be the first study of its kind in the whole world. And I showed that 92% of the women had gynecological problems and only 8% of the women had ever sought any care for gynecological problems. Total policy in the world changed. Previously, they used to call it maternal and child health. And I coined the word reproductive health and child health. So that word was coined by me.
They have been honored with the Padma Shri and Maharashtra Bhushan, along with numerous other national and international awards.
If we want tribal people to seek care, not feel shy, not feel afraid, we need to build a tribal-friendly hospital. So taking inspiration from Mahatma Gandhi's Sevagram Ashram, we constructed here our first tribal-friendly hospital of huts, which looked like a tribal village, didn't look like a hospital. And to again make tribal people feel safe and secure, we created a temple of their goddess. Their goddess is Danteshwari, and that's why this hospital was labeled by tribal people as Ma Danteshwari Davakhana. It had a unique design. Its origin and generation itself was through consultation with the tribal people. So it became a sort of a collaborative partnership between tribal people and us.
Under the chairmanship of Dr. Abhay Bang, he made a report with the help of an expert committee. The report was on tribal health. They found the health status of tribal people was worse than any other social section in India. He recommended various solutions to bridge the gap to bring the health status of tribal people anywhere in India at par with non-tribal people within 10 years by the year 2027.
Dr. Rani and Abhay Bang's dedication has helped millions of adolescents, youths and women take charge of their own bodies and health. They are the inspiration for around 9 lakh ASHA or village health workers.
And I'll begin the story with the year 1986, when Rani, my wife, and I had just returned from the US. And where should we work? If you have this question, go where the problems are and not where the facilities are.